Good morning. Welcome to The Scoop. I'm your host, Janelle Irwin. Evan Donovan is on vacation this week. Sean Canan is in the studio running the board, and Lamar Robinson is wrangling the phones. Before we dive into today's show, I want to say thank you to everyone who pitched in last week to keep the show on the air. Unfortunately, we fell quite significantly short of our goal, and I do mean quite significantly. But the good news is, if you missed the opportunity to donate last week, it's not too late. You can still contribute by going to WMNF.org and clicking on the tip jar. Remember, every little bit helps, so whether you're a big spender or on a charitable budget, our thanks is all the same. And one more programming note before we get started. As many of you may remember, St. Pete City Council member Darden Rice was scheduled to join us today to discuss her race for mayor. Unfortunately, her campaign canceled yesterday. I've asked if they'd like to reschedule, but haven't heard back. We'll keep you posted on that. And it's okay though, because we've got a just as important show lined up today, arguably maybe even more important. Joining us to discuss the mounting surge in COVID-19 cases statewide and in the Tampa Bay area is Dr. Jay Wolfson, a distinguished professor of public health medicine and pharmacy and associate vice president for health law, policy, and safety for USF Health. He's also the Senior Associate Dean for Health Policy and Practice at the Morsani College of Medicine. Dr. Wolfson earned his Doctor of Public Health from the University of Texas and his law degree from Stetson University College of Law. Dr. Wolfson, welcome to the show.
Janelle, it's great to be here. Thanks for having me.
Thank you so much for taking the time. So let's first lay out our current situation, right? As many of our listeners know, Florida is experiencing its worst surge of the pandemic since it surfaced in the state well over a year ago. Friday alone saw more than 21,000 new cases, mostly spurred by the new Delta variant, and hospitalization rates are skyrocketing, reaching a pandemic high this week at 10,389 new COVID-related hospitalizations on Monday alone, according to the Florida Hospital Association. And just about an hour ago, the association's new report today showed 11,515 new hospitalizations in just one day, again, shattering the previous record set last July. Dr. Wolfson, what do these numbers mean, and what does it look like locally?
The numbers mean that Florida is now leading the nation in COVID-associated positive cases and hospitalizations. And we're also one of the first states to experience the next strain of this disease, which is the Gamma strain that's coming up from South America through Miami and South Florida. And we don't know enough about that yet, but here's the landscape right now. The positivity rate, the percentage of people who test positive, continues to increase. In fact, we're at an all-time high of those people who test and test positive. The hospitalization admissions for COVID is at an all-time high, and we are reaching an all-time high for hospitalizations in ICUs, intensive care units, for COVID. It's a little bit difficult to be clear about comparing this year to last year because the rate alone, that percentage, is based on the number of cases per occupiable bed. And since last year, a number of hospitals have either increased numbers of beds or decreased numbers of beds. So you want to look at just the numbers. And the numbers alone are significant. We are dramatically increasing the number of people in our community who are getting this disease. But the more important thing is the number of people who are going to hospitals and ICUs, because that's when it gets serious. The other disturbing part is that the average age for people getting the disease and going to the hospitals has declined dramatically from 65 and 60 down to below 50 and into the 40s. Now, what that means is it's good news generally for the senior citizens in our state and folks who are immunosuppressed or who have multiple other diseases. And they were subjected to an aggressive immunization campaign when the vaccine first came out. But this disease creates a dilemma, because even if you've been vaccinated, you can still get the disease. These are called breakthrough infections, and we're beginning to see lots of those. about 3 to 7% of the hospitalizations for COVID are people who have been vaccinated, though 97% or more are unvaccinated. But here's the other part of this. Even if you have been vaccinated, we've said this from the beginning, no vaccine guarantees that you will not get a disease. Any vaccine will simply substantially reduce the likelihood that you'll get it or get sick or very sick or die. Same with influenza vaccine. But with this vaccine, there are two things that are happening that are a bit disturbing. One is the breakthrough infections, which happen, but some of those are severe. And the second thing is, even people who have been vaccinated and who have a mild or asymptomatic response, in other words, they show no symptoms, but they're still positive, they can still give it to other people. They shed the darn virus the same way that unvaccinated people do, and they shed it at the same rate. And the disturbing thing in particular about that is this variant, the Delta variant, which is now predominant, is hundreds of times more virulent. It's more powerful. It makes people sicker. And it's hundreds of times more contagious. So it's a lot easier to get. So if you happen to have been somebody in a long-term care facility or who has been vaccinated because of your risks, and you now think, okay, I don't have to worry. You do have to worry because you can still get it. But in our long-term care facilities in the state, only about 43% of the staff are vaccinated. And the people who were getting the disease and dying a year ago in long-term care facilities didn't simply spontaneously contract the disease. They got it from people coming into the facility, and most of those people, unfortunately, were staff. So we have a very contagious, very powerful disease that is spreading among the younger population, which is significantly less likely to have been vaccinated, more likely to go out and enjoy events in public with their friends in congested places. And the result of that is we are seeing the negative residual of hospitalizations and ICUs and a slight increase in death rate. And all of that places a tremendous burden on our hospital physicians, nurses, physicians' assistants, and general hospital staff. We had folks getting badly burned out last year. We don't want to see that happen again this year. So that's kind of like the opening landscape of where we are in our community.
So we hear a lot, especially from our governor, Governor Ron DeSantis, about the messaging coming from elected officials. His comments are typically kind of elevated to the top of the food chain coming from the White House, making these arguments that telling people that they need to go back to wearing masks, even if they're vaccinated, is sending the wrong message. Why would people want to get vaccinated if they still have to wear a mask? And then, of course, now we have with this Delta variant, as you've stated, very clearly, that those individuals who are vaccinated can still get the virus. They can still have severe illness from it, even if that risk is substantially reduced. So when you're talking about these people who are still reluctant to obtain a vaccine, how do you have a conversation with them to say, this is still something that you need to do, even if it means you have to wear a mask still for a little while, even if it means you could still get sick? I mean, how do you combat that vaccine hesitancy that we're seeing so prevalently in Florida?
That's probably the core question that we in public health and medicine are dealing with. And we've learned from other battles. We've learned from the smoking battle with teenagers and young people. We've learned about drunken driving, people drinking and driving, putting kids in car seats, wearing seatbelts. And it's not a matter of confronting or arguing, because that does not accomplish anything. In this environment, the politicization of the disease has placed people in diametrically opposed camps where the data mean nothing to either side. You are where you are and you're not going to change. What does appear to make a difference in some people's lives is if somebody close to them or they know gets the disease, gets really sick, and particularly if they die. Though I know many people who've gotten really, really sick, and they say, well, I'm done with it now. And, that's it. I still believe what I believe until somebody else in their family gets sick. It's very hard to overcome the hesitancy because there are, at least 2 or 3 reasons why people are choosing not to get vaccinated. In the African American community, as we've spoken on this show on WMNF in the past, the Tuskegee experience is not insignificant. And policymakers and even some of my own colleagues oftentimes don't really understand how powerful the Tuskegee syphilis experiment affected the African American population in this country, to the point where they have very little trust in any government-related vaccine program. And overcoming that is really, really hard, which is why enlisting the active support of community members, of church leaders, of local business leaders, really makes a difference. And that edges it up a little bit, but there's still that distrust. The second population still believes that it's too early to know whether or not the vaccine might have adverse effects, and they still don't want to be among the first to get it. And in some respects, Janelle, that's not entirely unfair. You're too young, but many of our listeners will remember that back in the 40s and 50s and 60s, there were 2 very significant events. One was thalidomide. Women took thalidomide drugs to prevent some adverse results of pregnancy, and children were born missing limbs and severely deformed. There were, hundreds of thousands of thalidomide babies that were born. Also in the 1950s, women who were experiencing early miscarriages for a number of metabolic reasons or physiologic reasons were given a drug called diethylstilbestrol, DES, and that was to reduce the risk of that early and premature abortion. And some 25 years later, a significant percentage of the women who were born to those pregnant women, the children of those mothers who received DES, developed cervical and vaginal cancer. And that was a real thing. You didn't know that for a long time. And there were other instances of vaccines and drugs which, after they were administered, had adverse effects. So there are some people who are genuinely concerned that I want to wait and watch for a while and make sure that others don't get bad things happening to them. The question is, how long do you watch and wait? And the third major group are those who simply believe, because of the political and social sources that they rely upon, that this is either a hoax or it is not as real and dangerous as the government makes it out to be, and that there's a conspiracy to cause us to get these drugs because it's going to make the drug companies wealthier, it's going to make the government more in control of our lives. And these are many of the individuals who state, I have a right not to do something. I have a constitutional right. You can't make me buy broccoli and eat it, which was one of the arguments in the Affordable Care Act legislation and litigation. You can't make me do something that I don't need to do. The dilemma with that is, and this country has been grounded upon personal freedoms and prerogatives, but the idea of a personal prerogative, I have a right to do something or not to do something, there is not a single right that exists in human behavior and in social and political systems that does not have an explicit and concomitant responsibility attached to it. These are not freestanding rights that exist that regardless of the effects that my behavior may have on other people or my community. And that's oftentimes not discussed. So dealing with each of those populations requires a different strategy. If you're concerned about a loved one who is refusing to get vaccinated or won't wear a mask, some of my colleagues are in households where that's happened. And some of them have said, look, I love you, I care about you, you're my child, or you're my wife, or you're my aunt, my uncle, but I can't take a risk of exposing myself to you if you get it, And my goodness, I don't want to expose you to me if I get it. So I'm not going to be around you for a while. You're refusing to wear a mask. I'm going to wear a mask around you, and I'm going to distance myself from you. I have to exile you in the household. We all have to do that to protect our interests. But confrontation is clearly not the answer, because that is only causing people to dig in deeper and become more abjectly grounded in the position they have.
If you're just tuning in to The Scoop Tuesday, I'm Janelle Irwin, and we are speaking with Dr. Jay Wolfson. He is a distinguished professor at USF Health, and he is a health expert, and that is probably an understatement given your credentials. We're going to be taking calls in not too long, or I will be taking calls in not too long. If you'd like to go ahead and get in on the queue, Clark is also manning the phones. The number to call is 813-239-9663. Dr. Wolfson, I want to ask you about schools. Obviously, for a lot of our listeners, the timing of this latest surge is really particularly troubling. With students ready to head back into the classroom next Tuesday in Hillsborough County and then Wednesday in Pinellas County, Governor DeSantis obviously has issued an executive order banning school districts from requiring masks at school, opting instead to leave the decision on whether to mask their children up to parents and caregivers. What does that mean from a public health perspective? And is this something parents and school personnel should be concerned about?
That's a particularly hot button issue, Janelle. There are at least 2 school districts in South Florida that have either already or are contemplating instituting mask requirements for their students and faculty. The governor has said, if you do this, you may be subject to both the executive order and the state law that was passed by the Florida legislature that said, if you violate that law, you can have your funding cut off. So an entire school district can be subject to having its money cut off by the state if they do something such as mandate masks or vaccinations. Parents need to be concerned. Both sides need to be concerned. There are those parents who genuinely believe that their children do not need to spend 6 or 8 hours a day wearing a mask inside a school building, and that there's some data, quite frankly, that indicate that in the school itself, the school rooms are generally pretty safe. If you socially distance, you keep kids apart, the rate of infection in the school itself tends to be very, very low. And if you catch it, then you can segregate the classrooms. It's what happens outside of the classroom and outside of the school day, as children are going to and coming from school and playing in their neighborhoods and doing other things with their families. And the fact that children may be more subject to having an asymptomatic version of the disease, so they can have it and they don't express any symptoms, but they may still be able to give it to others, and they can give it to others who may also themselves be asymptomatic. And then it takes several generations of the disease passing on through asymptomatic people before it hits grandpa or Aunt May or the next door neighbor. In the meantime, the governor is abjectly clear that there shall be no local mandates. And this is in part a constitutional issue, because there's something called home rule in most states, where counties and municipalities, especially the elected officials of those counties, municipalities, and organizations like school districts, have sworn authorities not only to uphold the Constitution of the state of Florida, but to ensure that the safety and security of their community and their children and their populations is assured through appropriate ordinances and rules and emergency measures. And what may be an emergency in Miami may not be an emergency in Pensacola. But the governor's mandate says it doesn't make a difference. We are telling you that you may not initiate those requirements. The bottom line for much of the state's policy, Janelle, has been people dying. And there's a term in administrative law when administrative agencies can take aggressive action to close down a business or to have an emergency standard that forces an organization to do something. And generally, the language that's used is that the agency has to demonstrate there is grave danger in order to do something. And I joke with my students and I say, we call it grave danger because we have to have lots of people going to their graves, kind of dropping dead like flies all around you. We don't have that happening right now. The death rate is low. And the governor and the state reacted with fairly aggressive policies when the death rate was climbing and when vulnerable populations were affected. So as long as the death rate remains low, it's very likely that as a matter of policy, the state is going to say, we're going to treat this like a bad cold. People are going to get sick and there's going to be collateral damage. And some people are going to get hospitalized, and that's part of the collateral damage, but we're going to balance the public health policies with the economic and social policies of the state and of people's lives, and we're not going to let one overwhelm the other. And hopefully, if the death rate continues to remain low, then a lot of people may get sick. Many people may go to the hospitals. Many people may go to the ICUs. Some people will die. And as this virus works its way through its cycles, and there are many cycles, the hope is that in some months, this